guys, my name is Matt McCoyd. If we haven't met in person, if you're taking the API course, you'll probably hear me give some of the lectures. I'm always really interested in your guys' feedback on those lectures in terms of if you think they're helpful, where I can improve them, et cetera. If you're a current fourth year resident, this is a great time to kind of start. If you're someone who's maybe already completed your residency training, you've been delaying, or just haven't had the opportunity to take the test, this is kind of a kickoff session, right? My experience, I've been the residency director at Loyola for about 12 years. So I've been going through this process as a residency director, as someone who took the exam and the research when we had to do that, and I've been working with API for over a decade. I always found like right now is typically when a lot of my senior residents start really kind of taking a look at the board exam. We certainly talk about it, throughout the 4 years, and realistically, you've been preparing for this exam for the last 3+ years or longer. Now's the time when I think a lot of people, they're hitting the second half of the academic year. They're getting within a couple months of the examination, maybe if you're not even in an academic year. And you're really starting to look down the barrel thinking, that examination is starting to come. And I even though I'm always kind of constantly learning and preparing in neurology, I really kind of want to get started specifically with board preparation. So I do think now's a great time to get started. There is a pretty high volume of content, but it's very manageable if you're starting now, which is what you guys are doing. And again, I would stress the majority of the information on the board exam is stuff that you guys have been living and practicing for the last several years. The examination is just trying to confirm the competency and basic knowledge around these topics. So when I talk to my residents, this is a point that I really emphasize. Now, if you're a current trainee, if you're a recent trainee, you have probably taken the American Academy of Neurology's residency and service training examination. The AAN and the American Board of Psychiatry and Neurology, and the ACGME, the American College of Graduate Medical Education, are organizations that are oftentimes very similar. They have similar goals in terms of establishing sort of the information that residents and physicians should have, but they are a little bit different. For most of our residents, they just took the right exam. It was just a couple of weeks ago. That can be a daunting exam, to put it mildly. If you think about, if you know what I'm talking about when it comes to the right, and you think about that test, my experience, having been around for a little while, if you score greater than 70% on the right exam, that generally puts you in the 90th percentile for the country, right? I can tell you one of our residents, I believe, got in the 98th percentile in the country one year. Obviously an outstanding score. I think he got a 78% on the test. I think that gives you an idea of the challenge of the right exam. It is designed to be an incredibly difficult test, where it is incredibly uncommon to score 80 or 90%. Its goal is to stratify residents from the first to the 99th percentile with an incredibly steep peak right there at that 50th percentile. I've seen residents maybe 1 or 2 percentage points above or below a colleague, and their percentile in the country will dramatically shift. So my experience is the residency in-service training examination tends to skew more towards the esoteric. It tends to include a great deal of pathology and a great deal of what I feel are at times sort of neurotrivia or obscure radiology. It is a good exam. If you performed well on the right exam, you are statistically going to perform well on the AAN exam or the ABPN exam. Both organizations have published literature, they periodically update it, that try to correlate right scores to board scores. If you do well on the right exam, I believe the number is greater than 65 or 60 to 65%. You statistically have a very high correlation with passing the exam. If you scored under 60%, you still have a high correlation of passing the exam. Right? And I think that speaks to the challenge of the right exam. So just a constant point that I emphasize with our residents, the board exam is not the right exam. The right exam is much more of a neurotrivia. If you do well on the right exam, you're going to love Neuro Bowl at the American Academy of Neurology annual meeting. I hope you're going this year in Seattle. It's a little bit more like Jeopardy than what the board examination is trying to emphasize. The board examination is really trying to emphasize common topics and establish a core competency when it comes to your medical knowledge as a neurologist, right? So it sort of changes your thinking a little bit. one thing that I really like to emphasize, you think about that. So great, they're gonna ask me. They're really going to potentially try to emphasize do you have the core medical knowledge around neurology? So what do I need to know? Neurology is a big topic, a big field. If you're talking to different faculty members, everyone's got different areas that they think are important, et cetera. So one of the documents that I have really come to appreciate and really try to emphasize, both in my teachings in the API course as well as with my residency program, is the ABPN's board examination blueprint. So if you go to the ABPN website where you signed up for the exam, they will list under certification, you can find the content outline. They started doing this back around 2017. At that time, there was a big push nationally for board reform, really spearheaded by internal medicine. And one of the things physicians wanted was more transparency in terms of what was on the examination so they could prepare properly. And as a result of that push, a number of the organizations in the ABPN specifically started publishing their content outline. I have found this document to be extremely helpful. I'm willing to accept that it is long. It is about 37 pages long in a bulletproof format like I've got up here, but I think it's extremely high yield. The document, as I look at it, sort of has two parts, dimension 1, dimension 2, which I'll get into here briefly. But to me, this is your board exam. This is the information that you would really need to know. Now, I find that some of the topics, most of these topics are common. If you're someone who enjoys any of the neurology review books, Adams and Victor, Continuum, et cetera, these are your common core topics. And actually largely reflect the ACGME milestones, right? The major topics neurologists need to know. Then I will bullet point them, which I will get into. My feeling is if something isn't in this content outline, though it's possible it can be tested. Every section includes an other, sort of a catch-all. But man, you can do a lot of studying looking for other and spend a lot of time on things that really are esoteric and don't change your score all that much, right? So nailing these questions that will be on there, I think is really, really critical. All you're trying to do is get past a passing threshold. So dimension 1 sort of lists big, broad buckets. That doesn't help you all that much. The percentages kind of give you a rough idea, kind of what's there. But that's sort of your overview, right? That's your ACGME milestones. Those are your continuum topics. Those are your kind of big headliner topics. Dimension 2 is very short. This is all they show you. Dimension 2 really kind of tells you what are the questions going to ask you about, right? So if they're going to ask you about a specific diagnosis, well, what would the question be about? Well, it might be about mechanism of disease, so kind of basic neuropathology or pathogenesis. Really a strong emphasis on clinical aspects. How do patients present? What's the appropriate testing you need to do? How do you manage these conditions where we know that there's management? I'm going to get into that topic as well in a little bit. Those are probably the core of your examination. And if you look at the percentages, that is pretty close to about 80% or so, right? So the fundamentals, can you make a diagnosis? Can you take a history, localize it, make a diagnosis, and how do you manage this? The bottom part is some of the other almost ethics, interprofessional communication, professionalism, practice-based learning systems, et cetera. So dimension 2 kind of gives you an idea, well, how they're going to frame the test question. All right. Where I like the content outline is in this part. That first part says, hey, these are the broad topics. If you go into that outline, and most of our, if not all of our speakers do this, I know I do specifically for my lectures, they bullet point the topics you need to know, right? So it is very specific that you need to know about, for example, migraines, tension type headaches, cluster, and then other primary headache disorders. My feeling has been this is really the kind of meat of the exam. And again, I think some of these are more obscure than others, but if they listed it, I think it's fair game. Generally speaking, they're going to go after the sort of most common and core things the most. But I've always felt like if it's on the outline, we should at least think about it, and I should know something about it, particularly some of the fundamentals. I think this is perfect for creating a study guide, writing note cards, whatever you think you need to do in terms of just sort of organizing your thoughts and information around it. So it is a lot of content. Again, I would emphasize, hey, this is stuff you guys have mostly been doing, right? I mean, if you think about your continuity clinics, if you think about your personal practices, what you do in the hospital, Well, you treat migraine headaches all the time. You deal with cluster headaches. You deal with tension headaches. You've dealt with patients with idiopathic intracranial hypertension. They're not going to ask you, for the most part, they're not going to ask you incredibly obscure things that aren't part of your practice. They're looking to establish competency around the common neurologic topics. And what this content outline does is it gives you a very, very good idea. Man, what's the most high yield stuff I should know? I'll make this point a couple times. Answering a question correctly about carpal tunnel gets you as many points as answering an obscure question about Susac syndrome, right? So take the easy points and kind of move on. So other kind of things, kind of emphasizing that. Really important thing to think about is taking the test. Don't outthink the test. I think that there's a tendency to approach the board exam and go, this is going to be the hardest exam. And it is a challenging exam. This is not an easy exam. It's an exam I think you very much have to prepare for. You have to prepare for it throughout the 4 years of training. You need to prepare for it in the couple months here you got coming up to the test. I think it's a legitimate exam. I think it's a fair exam. I think if you prepare for it, you can very much pass the examination. But I think there can be a tendency. So this is the board exam. This is the kind of big end all be all. And they're going to ask me something really, really challenging. They're not going to ask me a common question. So for example, you'll get a patient. I don't know what's on the exam, but just as an example, they'll give you a patient. They say, listen, the patient's these 3 fingers are sort of numb. They got to wake up at night and shake their hand out. They're sort of dropping objects. What's your diagnosis? And you're going to think to yourself, man, that sounds like carpal tunnel. But there's no way they're asking me just a simple carpal tunnel question. And for the board exam, they're asking you a simple carpal tunnel question, right? Don't talk yourself into something super obscure and esoteric. Kind of focus on the common stuff, right? Just think, what would I do in clinic? If I saw this patient in the clinic, if I saw this patient in the hospital, what would I diagnose them with? And they're more likely to ask you common questions about common diagnoses than uncommon questions about uncommon diagnoses on this examination. So when I've gone to the meetings at the American Academy of Neurology and listened to these organizations speak, that's a point of emphasis. They have a high bar for certification, but their goal is to confirm that you have achieved competency when it comes to medical knowledge in neurology. The goal is not, for the most part, to confirm esoteric knowledge, right, or extreme kind of neurotrivia. Even though if you know it, that's awesome, and it's going to make the test easier, and it's also just sort of fun. So generally speaking, a question is far more likely to be about common disorders like carpal tunnel than obscure diagnoses. Don't think it can't be a normal. So sometimes normal is normal. A patient with a non-specific examination and a non-specific headache might have a normal head CT, right? Don't try to outthink it and go, well, there's no way they're going to give me a simple normal head CT. You didn't train to be a pathologist. They're not going to overly emphasize obscure pathology pictures. That's not what we do as clinicians, right? It's not the role of the neurologist to look at path slides and make diagnoses. Our goal is to understand who needs a muscle biopsy and what am I kind of big picture diagnostically looking for. There will be some pathology on there. Generally speaking, it has stuck to maybe the most common diagnoses and really common presentations of them. This is not a pathology exam. It's a neurology exam. Another part, and this is another place I see the board exam really diverge from the in-service training exam and from continuum questions, for example. The board tends to avoid areas of controversy, and it will generally go towards things that are widely agreed upon. Well, I've had the opportunity, I've not written questions for the ABPN, but I've written questions for some other board agencies, and they want exam questions that are fair and questions that we agree on. So think about that. You can't write a question, what's the best treatment for multiple sclerosis? You're going to get in a long argument with a lot of really intelligent people as to what the best treatment is in different situations. So you tend to avoid those. What can you ask about? Well, you can ask side effect questions, right? Maybe I don't ask you what the best MS med is because that's a debate. But where they can really try to emphasize things is, well, what are side effects of the common medications? When can't you use a medication? What should you know about a lot of these meds? That'd be more important than knowing, but what's the specific efficacy of a drug? What percentage does it reduce your risk by? How much does that matter? What really matters, well, do you know the side effect profile? Do you know who's contraindicated from using a medication? Is there a specific indication to use a certain medication? I've also found one other thing that can be extremely helpful. Read the question stem first. Sometimes the board exam will give you this incredibly long, verbose question stem. At the end of that stem, what's the side effect of natalizumab? Well, maybe I didn't need the question stem to answer that. So I got in the habit, and I have my residents try to get in the habit. Usually the last line is the question that frames what I'm looking for in the content, and then I'll go read the content outline. So focus a lot on what a neurologist does, I think, is also critical. For in-service exams, sometimes memorizing genes is a big deal. I think for the most part, memorizing specific genes or the chromosome they involve isn't all that helpful. I think knowing the mode of inheritance is really critical. There may be a handful of genes that I think are good to know, and we try to outline those in a lot of the lectures. For example, if you look at AAN content outline, AAN recommends certain genetic tests for hereditary neuropathies. Well, I would probably know what PMP22 is. But board exam is much more likely to emphasize how do you counsel the patient and their family, right? So a patient with hereditary ALS and the gene is C9orf72, what's the mode of inheritance, right? Because that's really now how do we counsel families? What do we do with this information? More than esoterically, well, what's the specific chromosome the gene's on? That's the sort of stuff USMLE does and why they're getting rid of some of it. So thinking more on, well, what would my role as a neurologist be? Well, it's to, a lot of it has to do with, hey, the patient question, how do I counsel my family about this diagnosis? So I think focusing more on mode of inheritance for the counseling aspect is much more critical. Again, though, I think it's important to focus on what a neurologist does. We're not pathologists, we're not radiologists. We are considered by our board psychiatry, neurology, and pediatric neurology. So some of that's going to show up on your exam. So psychiatric disorders, neuropsychology, and pediatric neurology, those are all worth the same number of points. It's a smaller percentage of the test. In the past, you had to pass each section of the test individually. That is no longer the case. You have to pass the exam in its totality. Traditionally, I will tell you, the place that neurologists get tripped up the most is going to be in their peds and their psychiatry, for a simple reason. This isn't what you do on a day-to-day, week-to-week basis, right? You generally speaking, you spend most of your time treating adult patients with neurologic disorders. But there will be questions on psychiatry and on pediatric neurology. So those are going to be probably the more challenging questions because they aren't a part of your routine practice. So you can't rely as much on some of your clinical experiences to answer questions as much as what you're going to kind of focus on. So this is where the content outline, I think, is extremely helpful. I'm not a pediatric neurologist, so what do I need to know? I do in my own personal practice, I do a lot of neuromuscular care, and I do a lot of multiple sclerosis and demyelinating diseases. I admittedly am not as comfortable with pediatric dysmyelinating disorders. So when I prepared for my recertification examination, when I do the lecture for my residents on demyelinating conditions, what I find to be really helpful is looking at the peds and psych aspects of the outline. For pediatric neurology, genetic and developmental disorders, really bullet points out the diagnoses you have to know. And I find that to be extremely high yield. You know you're going to get a question on one of those, and it tells you which one specifically. It doesn't tell you the exact one, but it's going to give you a list of maybe 6 to 8 dysmyelinating disorders. You also will want to take a look at the epilepsy section where a number of the epilepsy diagnoses come up. Think about how do I make the diagnosis and how do I counsel the patient and the family about long-term risks. So psychiatry also has a pretty lengthy and very dedicated section in the blueprint. It is, I find, to be highly specific. I would spend some time on that, right? This is my own personal feeling and one I tell our residents. Decide how you want to prepare for psych and peds. Think about what you're going to be doing in the fall and what you're going to be doing in the spring. You're going to be doing some aspects of neurology. If you're going to be a stroke fellow, you're going to be a critical care fellow, you're going to be an epilepsy fellow, you're going to spend a lot of time doing that. You probably don't need to study stroke. We actually tell our residents not to. We have a pretty stroke-heavy program. We tell our residents not to study stroke. Right? We're doing it day in, day out. Maybe a quick review, but man, we do a lot of that stuff. Think about what you don't do. And so think about peds and psych. How are you going to prepare for that? You've got time here, hopefully, over the next couple months. Really kind of think about putting together how you want to study. And I think some of the review lectures are really great. man, that's the thing I would probably study at the end, right? So maybe spend a little time now preparing how you're going to study it. But that to me is maybe the last thing that I'm going to study. And the simple idea for me being, I'm probably not going to remember this. I will tell you, I'm going to keep kind of going back to pediatric dysmyelinating disorders. I know it once a year for about 2 days when I give the lecture. And then I rarely see pediatric dysmyelinating disorders, right? And if I see it, I think I can generally kind of recognize it, but am I going to know all the nuances of a specific disorder? No. So if I'm taking my exam, that's the thing I'm probably going to study right before the exam, right? The couple of days or week or two before, and really kind of do that rote memorization, kind of going back to what you did in your pre-med and medical school courses and getting ready for that material that's just not part of your routine practice on a day-to-day basis. So that's my own preferred study strategy. I really like the things that weren't part of my routine practice, things I don't do regularly. I like to kind of keep near the end with the idea that, I mean, if I spend the next 2 weeks studying peds and I got to take a test in 6 months, I probably won't remember it. So I prefer to kind of have a plan for how I'm going to do it, maybe prep my materials now, but really study that more towards the end. Last piece of advice, as you guys are getting ready, and again, I think this is the time to really start kind of buckling down and getting ready to a certain extent, and getting your notes together. Hopefully, if you're a senior resident, you've got some time here. If you're already in practice, it's probably even more important to be really efficient with your time. This is just a written test. This doesn't determine your worth, your value as a neurologist. You've already proven that. You've put a lot of work in over the last several years in your residency, your fellowships, maybe in your personal practice. Your ability to work as a neurologist has to a large extent already been determined. You've earned that competency through taking call, doing work, et cetera. This is just a test to confirm objective medical knowledge. And that's it. It doesn't say if you're a great neurologist, average neurologist, whatever. You already proved that, right, with the work that you do. So your goal is to get prepared, go out there, take the test, and then move on, right, and be done with it. So with that, I will stop. I spent about half the time just trying to go kind of broad bucket here, kind of giving you sort of set the table a little bit with maybe what to expect for that examination. Obviously, the lectures are going to get into a lot more nitty gritty. And if I can do it, I'm going to try to answer some of the questions. And Michael, I might need your help for this part.
So the first question is, any strategies on how to answer the linked item set questions?
I just want to make sure for the linked items where it goes through, you get like 5 questions.
That's what I would assume based on the AV plan format. So.
Yep, and so one of the format of the test, you've got some questions that are just your traditional question answer, right? And you can kind of move around within that section. That's where your traditional test taking strategy is answer the questions mark the ones you don't, and go back and get them. So for the linked ones, and if you're not sure what we're talking about, what the board exam will do is it'll give you a question, and there'll be multiple questions in a row that build on each other. The concern is, well, if I get the first one wrong and it kind of takes me down a pathway, do I sort of by default get all of them wrong? And the answer is no. And I will tell you, this is an area where if you played sports, this is helpful. You got to have a short memory on this one, because what will happen is it will give you the first question, and it'll say, what's your diagnosis or whatever, and then the second question, it will then typically tell you what the answer was to the first one, right? Which should then clue you in, hey, well, this was the diagnosis. But you can't go back, right? So once you answer in these linked ones, it locks you in, right? So that question's done. So where's the challenge? So if you get it right, it's really reassuring, right? Okay, I think the diagnosis is Guillain-Barré. The next section says, okay, the diagnosis is Guillain-Barré. Well, how do you diagnose it? The challenge is you answer the first one, it's easy. It's Guillain-Barré. I got it. I'm moving on. And it goes, all right, well, the answer was polio, not Guillain-Barré. You've got to just say, forget it. I'm moving on, right? My goal here, no one cares what number you get on this test, right? No one's going to ask you the percentage that you got. I got to tell you, when I got my certification, I don't know what it said in the second sentence. Say, congratulations, congratulate you on passing the exam. That's the last thing I read. I'm sure there was more in that document. So for the ones that are linked, you cannot go back, but it will essentially give you the answer. As a result, it doesn't default you into 5 wrong answers. So silver lining, you have the opportunity to kind of recover. The flip side is you got to have a short memory for that. And you got to say, well, you know what? I missed that one, but I'm going to get the other 4 right. And I'm going to kind of keep moving on. I'll also tell you it's entirely possible. I think that the content outline is extremely helpful for knowing what's on the exam. They can always throw a curveball in there. I'm not going to get into the specific diagnoses, but I remember I took the exam and it was a linked question, right? I'd never heard of the diagnosis. And I just thought, you know what, they win these ones and I'm just going to move on and I'm going to get the next ones right. And that's fine. So don't worry, it will not default you into automatically getting them all wrong if you don't get the first one correct. But again, if you happen to not get it, it's okay. You missed 1 point. That's fine. There's 400 questions. Let's move on. All right.
Okay, next question. Is there anything on the content outline that I could just ignore or skip over if I don't have time to cover all the topics?
Yeah. So, just first of all, take a look at it, right? And one thing I would start with is, well, what are you already really comfortable with, right? I mean, and we're sitting here in March. This is a great time to at least look at that content outline and just kind of skim through it. Well, what do you already know? Because odds are you already know a lot of this stuff, right? I mean, you've been through, again, either 3.5 years of residency training, maybe longer if you're taking this during your fellowship, and maybe longer if you've delayed the examination or you're just having the opportunity to get around to it. So just kind of take a look at it. And are there certain topics you already feel extremely comfortable with, right? Well, okay, well, we're not going to spend a ton of time on that. If you're a neuromuscular fellow or you do a lot of neuromuscular stuff, spending a lot of time on, basic neuromuscular isn't critical. If you do multiple sclerosis care, same thing. That section's not going to take you a ton of time. But at least look at it and say, is there anything weird on here I've never heard of? I don't really know anything about. I think what's on that outline, I think it's kind of fair game. They do give you an idea kind of percentage-wise how much stuff is going to get asked, but it doesn't tell you within that content. So for me, the big thing is look at what don't you know, and that's going to be different for different programs depending on where you trained, right? Some programs are very strong in certain areas, and just because of whatever reason, maybe not as strong in other areas. So take a look at what you don't feel comfortable with and think about how you're going to focus on that. I'll just kind of keep emphasizing that. I've been saying to my guys all the time, peds and psych, man, that's not part of what we do as a practice. So really kind of thinking about how you're going to get ready for those sections, I think is critical because it's a decent number of points on the test. It's pretty straightforward in terms of, I think, what they're going to ask. And it's not part of what you do on a regular basis. So at least skim through it and say, hey, there's some things here that I don't know as much about. I think there are some areas where you can probably get a little bit broad bucket, just from having done it. When you kind of look at neuromuscular / neuroinfectious disease, it goes over like all sorts of like spider bites, venom bites, etc. I think just sort of knowing that those are toxins is important. There's a couple things on there on industrial solvents. I don't know that it's really critical to know the exact syndrome industrial solvents cause as much as these 4 industrial solvents cause neuropathy. So I think there are some opportunities that hopefully are highlighted in a number of our lectures where you can say, well, just be aware you got to kind of know these topics. So again, think about what you're strong at, think about what you're weak at, and focus more on those areas of weakness. I know 37 pages feels long. I know that, but it's not that long.
Okay, next question. Can you please give us a few sources for practice questions or practice, like maybe I'm assuming practice exams?
Yep. In terms of answering questions, a couple of things. So one, obviously you're here because you've got an interest in API. I think inside the lectures, we try to do a good job in terms of providing board style questions that I think are high yield. So I think we really try to emphasize that in our lectures and in that content. Some other areas, depending on your access points, that I think are helpful. And I'm pretty sure I can do this even though I'm sitting here speaking for API. The American Academy of Neurology, one of its goals is for its members is board passing, right? So one of the things that I've really liked is for questions. The AAN publishes neuro self-assessment exams, neuro SAEs. I think those are really good. They are multiple choice style questions, very similar to what the board exam is going to be like. And there's a couple ways you can take those questions. You can either take the question and it gives you the answer, sort of immediate feedback. You can bundle questions. So I'm going to answer 10, 20, 40, 60 and get feedback at the end. I think those are really pretty high yield questions. If you're an Academy member, which many of you probably are through your residency program, that content is free. As long as you finish a test before you open the second one, right? So if you take one test and you don't finish it for any reason, and then you try to open another one, it'll say there's a fee. You just have to finish the first one. So I found those questions to be, I think, really pretty high yield and in a format that's similar to the test. So getting used to taking, and you guys are pretty used to this at this point, but taking online test questions, I think it's a good idea. You should get closer to the examination to do some of them under time, right? So, give yourself, hey, I'm going to answer X number of questions in 20 minutes and kind of get the sense of the clock and sort of the pace and the rhythm of the test. But I have found that to be, I think, a really helpful, and again, for many of you, probably free, hopefully free resource if you're an Academy member.
Just as a side note on that, if you have the API course, I believe there's probably close to 1,800 multiple choice questions that you could take as practice as well. And it's in the exam builder tab on your dashboard. And that actually, what's cool is you could actually choose different topics to take questions on, or to do like a mock exam of 400 questions. And I think there's an algorithm built in based on the content outline. So if there's 10% of the questions on your exam are based on headaches, then you could build an exam with 10% of the questions on headaches. So it's a good resource to use if you weren't aware of it right now. But yeah, there's over 1,800 questions that are part of the course as well. So and someone asked, I believe they're just asking like, how important is it to maybe take these other courses with question banks, or just answering question bank questions?
Yeah, so I think it's part of your practice, and right. So there's obviously the questions through API, the other ones I mentioned. I think it is important to get in the habit of answering test questions. What makes you good at answering test questions is the material, but a way to confirm the material is to take test questions. So the analogy I would give, if my son plays baseball, if you want to get good at hitting baseballs, you go out and have someone throw you baseballs and you try to hit them. It's right. So it's a written test. So taking multiple choice style questions, I think, is really valuable. I would point out, and this is in the ABPN's site, we try to go to great efforts in our test questions to make sure we're writing them in the style that the ABPN does. There's not true false questions. There's not questions. Which of the following is not the correct answer. There are not kind of multi-answer, A through E, 1 through 5, link them up. So everything has an answer. I do think doing test questions is valuable. It's just a way to confirm the knowledge you have, and also to confirm probably the areas that are critical, and as well as to shine light in terms of maybe some areas that you're not as good as you think you might be. That's actually really valuable feedback, right? If I answer 20 questions on a specific topic, we'll use headache. Michael just mentioned it. Man, I got 10 of them wrong. Shoot, maybe I don't know headache as well, and I should go back and take a closer look at it.
Okay, next question is, I did not pass the exam the first time around. Do you have any advice on what I can do for my second time taking the test?
Yeah. So hopefully you got to look at this test, right? And hopefully that makes it a little bit easier in terms of getting a sense of, hey, kind of how was the test format? How did I feel in terms of comfort level taking the test? Were there certain areas maybe I didn't feel as comfortable with? I do think for a lot of folks, there's a skill to test taking, right? So some is looking at, hey, how do I approach the test questions? Do I think I'm answering the question correctly, right? So looking at that question stem first. What was the question stem? So what are they actually asking me, and making sure I'm answering that versus getting lost in some of the details. Having the ability to mark and move, right? answering the questions that are easy. Do not get hung up on hard questions. You can burn a lot of time and a lot of effort. When you're in these sections of the exam that you can mark and move on, let me get to the questions I know correctly. Let me answer them and move forward. Right? And if there's a question that's really challenging, I'm not sure I know the answer, I'm just going to mark it. I'm going to move on. I think can be really pretty valuable. Don't outthink the test. I think that happens really commonly. You think, man, this is the board exam. This is kind of the Super Bowl of exams for us. It's going to be more challenging. Do what you do best. Focus on the things that are common. I think there's a very easy on this exam to take questions where you're like, man, I think that this is carpal tunnel. I think that's a normal head CT, but it's just not going to be that. It's got to be more complex. No, they're looking for more common topics. Don't outthink the test question. Don't reach for the esoteric. It's been one of my biggest criticisms of some of the exams kind of throughout medicine, is that there can be a tendency to focus on neurotrivia. And as a result, the sort of learned behavior is, well, I'm going to reach for the more esoteric. Nope. Yeah, this exam is looking for the more common. Yes, there's going to be a couple esoteric questions on there. There's going to be something on there every year that everyone goes, wow, that's a heck of a test question. And good for them, right? They win that one. Try to focus more on the common things. Be careful reading your test questions. Really read that question stem first. Make sure you're answering it correctly. If I had a question I thought was too easy, I would usually pause and say, I'm just going to reread this and make sure I got it right. And a lot of times it was just that easy. And again, in terms of content, Psych Competes nails everybody every year. And it's done it for the history of this exam, 40, 50 years.
Okay, next question is, do the linked item questions have more than one correct answer? All
right. So the ABPN has gone back and forth on this. At one point, they were going to allow more than one answer for some test questions. I think it's a small percentage of the test if they still do it. I'm actually looking for the 22 content outlines up. It's possible, but it's fairly uncommon. And full disclosure, and please feel free to email me, and I'll try to get you more information on this, which is publicly available. I don't know how you would know if you can click more than one answer. Usually it defaults you into one, but I will try to get more information on that. So.
Okay, and then going back, so to the question about any other kind of resources for question banks, is there anything else besides, I think you mentioned that AAN has kind of practice questions you could do if you remember, but anything else that you came across that might be helpful?
Yep. So we mentioned the API 1,800 questions. I mentioned the AAN neuro self-assessment exams. I like Continuum as well, if you do have access to that, if you have access to your residency program. Continuum is a publication through the American Academy of Neurology. If you look at Continuum topics, they tend to be the exact same topics as the ABPN board examination. Right? So if you think about Continuum articles, there's one on headache, there's multiple sclerosis, there's neurocritical care, there's epilepsy. That's the ABPN content outline. I have noticed recently for Continuum, many of the articles mirror the ABPN content outline. There's an article from several years ago on it's like evaluation of dizziness in the outpatient setting. And if you look at it, it actually follows the ABPN content outline. And the thing that stands out is in the article, there's a thing on disembarkment syndrome, when you get dizzy on a boat. And I remember reading it thinking, well, that's stupid. And then if you look at the ABPN content outline, it's on there. So Continuum does have questions as well, and you can get the answers right away. It's in the same article. I think those are good. Some of those do. I will say one downside is I've noticed they will sometimes be willing to ask questions about areas where there can be some debate, which a board exam rarely is going to do. So I think that some of the occasionally I'll see questions I'm like, we could argue about this, but I just think it's those are nice questions in the articles that tie into very specific kind of review topics. So again, Michael mentioned the 1,800 questions through API, the neuro self-assessment exam, and my residents think I'm crazy, but I'm a big Continuum fan as well.
Last question that we have so far is, Do you know what the passing score is to pass the exam?
They don't, to my knowledge, that is not published. There's not a published number that's out there. So I do think that the passing number does fluctuate a little bit. I will tell you, if, again, going back to the right exam, this is where the difference is. Yeah, the right exam, over 70% is 90th percentile, right? So for the board exam, if you score over 90%, you passed. If you score over 80%, you passed. The number typically, I think, on average, and I've never been to a meeting or read anything where the ABPN publishes the pass rate, it's usually in the 70% range. So somewhere between 70, 75%. If you look at the percentages on the exam for topics, this is where the psych and the peds can really hurt people. It's not what we do as a part of our practice, and it's a decent percentage of this examination. I don't have it right in front of me, but off the top of my head, it's a pretty significant percentage. And if you just get crushed in psych and peds, it doesn't leave you a lot of room for error for the rest of neuro. So that's where, not that the whole exam is psych and peds, but man, that's the one part of the exam that isn't part of your regular practice, that those questions count just as much and can really kind of hurt you. So usually the cutoff is somewhere in the 70s, to the best of my knowledge, for everything I've seen and heard. But again, I don't think the ABPN ever publishes the specific target. So
one person is asking, how do they frame the continuum?
Yep. So it's continuum lifelong learning in neurology. Again, that's published by the AAN. It's the AAN's kind of review journal. Comes out every other month, and they've got a library. I would just say in general, and when you see my lectures, you're going to see it, because I reference continuum pretty heavily, because I think it's a great resource. I do use other ones as well. I'm not exclusive to continuum. So continuum lifelong learning in neurology. I think if you go to the AAN website, there's a link to it. Being an AAN member alone doesn't give you continuum access. If you're part of a medical staff, if you're part of a residency program, I would hope that your library has a link to it. And that gives you access to past content as well. It used to be the gold journal. Now they've changed the color. It's, I think, sort of a whitish color. I think that's, kind of independent of getting ready for the board exam. I actually think it's just sort of a great thing to have access to in general. I found it to be pretty high yield for me. Whenever I'm giving lectures, whenever I'm talking to medical students, residents, I usually kind of hit up continuum looking for stuff as a good starting point for me.
Going back to the linked item questions, I'll look into it as well. I have a contact at the American Board of Psychiatry and Neurology, because I know psychiatry linked item questions on the psychiatry board exam could have multiple answers, but it's not clear on the neurology board exam if it doesn't state whether it could be multiple correct answers or not. And I know in psychiatry, you can have multiple correct answers, and you actually have to mark all correct answers to get credit for that question. So I'll send an email out to the ABPN, and if I hear anything back, I'll let Dr. McCoyd know, and also everyone that's attended today. So we have about 10 minutes left. I don't know, we don't have any more questions, but if there's anything else maybe that you can speak on, Dr. McCoyd, to any other maybe tips or tricks, or kind of I think some people might also have anxiety before the exam or anything like that to kind of to help
Yeah. So
with the last 10 minutes or so.
Yep. So I would say probably one big thing is be careful of tomorrow. Right. I think sometimes taking that, not to be super cliche, which I'm about to do here, taking that first step is sometimes challenging. You have time right now. I mean, we're sitting here in March. So you're going to have March, April, May, June, July, August. You got about 6 months, which is plenty of time to get ready for this examination, plus all the work you put in for the last couple of years. I think there can very much be a tomorrow phenomenon. I'm going to start tomorrow. Sit down and come up with a plan. The sooner you start, the better. Somebody mentioned earlier, hey, that content outline is long. And every time I look at it, I go, it's long. That's why we try to start with this about 3 years early and try to emphasize a lot of this material. So kind of look, you're here tonight, so you've already started. take a look at that outline and just start thinking, all right, if I break this thing down, kind of where do I go with it? How do I kind of work my way through basic anatomy, which is going to show up, right? That's actually pretty clearly in the neuromuscular section. I'm going to steal from Zach London here from University of Michigan. He said, everybody writes in their personal statement, I was fascinated by the brain. That's why I went into neurology. He said, I'm waiting for the guy who writes, I was fascinated by the peripheral nervous system. That's very much true. So you just kind of start looking at that and thinking, all right, where do I want to start? Maybe I'm going to start with the order the thing comes in. Headache is first for some reason. And how am I going to kind of start working my way through? How do I plan out my time? I will tell you, Michael's going to know this answer better than I do. The number of hours for this course is pretty long because it has to be, because we cover a lot of ground. So biggest thing, you got 6 months. On the one hand, you can say, yeah, 6 months, I got a lot of time. On the other hand, if you're in residency training and you're a senior, you probably have an end of the year project that's due. You probably have to give grand rounds if you haven't already done it. You probably have your, kind of end of the year research or QI project. Hopefully you're going to the academy meeting in Seattle. You're potentially looking at moving to start your fellowship. You're going to start your fellowship. That's going to be pretty busy because all of a sudden, that's an adjustment. This is really manageable in small but steady increments. Making a plan. Hey, I'm going to answer questions 2 or 3 days a week. I'm going to work my way through the API question bank. I'm going to work my way through and I'm going to do this on a regular basis. Just kind of slowly but steadily start working my way towards it. And again, you guys are here, so you're already taking those first steps. If you wait until August or September, it's a lot of material, right? This is material that's summarizing a 4-year effort. So maybe the biggest thing is starting now. You mentioned kind of anxiety on test day. That's completely understandable. Right? Everyone's had that. I had it both times I took the exam. When I took the initial, when I took the research. One thought was, hey, you just like you do in the emergency room when you're seeing a patient, you just kind of got to calm down, quiet down, and focus on, hey, they're more likely to ask me common disorders than uncommon. Let me not outthink the test schedule. So, let me get started early. So blanket study schedule. Someone just asked this question, hey, is there kind of a blanket study schedule? I would say no, but just because step one is kind of determine what are my strong suits and what are my areas of weakness. When I took the exam, I knew, and when I took the research, I knew, well, all right, psych and peds, that's going to be an issue. At that time, there were certain anatomy topics I kind of knew would show up and I wasn't super comfortable with. Brachial plexus, thalamic nuclei, right? I know there's going to be 1 or 2 questions on there. So kind of how do I kind of work through those? So think about what are sort of the topics where I need to start studying, and then what's the sort of process I'm going to do? And that's going to depend. If you're someone who loves the peripheral nervous system and you've really kind of got all these nerves down, it's probably not something you need to study. Certainly not as much. If you're not super comfortable with all the different stroke syndromes, which is something I don't do anymore. All right, well, maybe I study that now, right? And I kind of build up my study materials, and then I'm going to look at it at the end as well. So, I again, kind of what do I look at for initial guidance? Take a look at that content outline. That's your exam. That's it. I mean, they're telling you what's on the exam. I get it's daunting. It's 37 pages long. They're telling you what's on. It's a 400 question exam. They are telling you what's on the exam in that content outline. Yes, they're going to throw a couple esoteric curveballs at you, but for the most part, that's it. Think about what you're weak at. Think about the things that aren't part of your routine practice. I got to prep that material, and at the end, that's where I'm going to kind of just nail my rote memorization, just like you've been doing at every test forever, kind of throughout your career. So I think that's going to be pretty individualized in terms of your approach to kind of what comes first, second, third. But starting now, what would I probably do this time of year? I would start putting together outlines for the topics I'm not comfortable with because I got time. And then I at the end, I would go back and re-hit that material. And not to be a broken record, psych and peds. Psych and peds are the bane of this test. And it's not what we do on a day-to-day basis.